Hey guys, this video is gonna be about ostomies. So first thing is what to educate the patient about, and the second thing is how to demonstrate changing an ostomy system. So first is education. So when you're educating a patient who either has a new colostomy or maybe they've had it but they're not doing it properly, you want to make sure they, one, know how to change the system. So it's important to demonstrate it to them, and then maybe the next change, they can demonstrate it back to you. Make sure that when they are changing the system, they're assessing the site. So the stoma, it should be beefy, red. If it's black, it might be necrotic. Make sure that they immediately call the doctor. You also want to assess the site around the stoma, so the skin around it, because if the appliance that they're putting on isn't fitted right, it could irritate the skin around the site. It can also, if it's too big of a appliance, then it can cause the bowel to leak and just irritate the site. So make sure that they know when they put the appliance on, you want to have 1/8 of an inch of a barrier around, so that allows the stoma to be securely in there without being too tight where it cuts off circulation, but not being too loose where the stool gets around it. Another important aspect to educate on is diet. So I think to maybe avoid or limit consumption of is foods that patients know will cause them gas. So that's things like broccoli, beans, all things. So that they don't have to not eat it. They just might want to limit their consumption because it can cause the bag to fill up with air. They can always burp the bag, which just means to release some of the air, but they should be emptying the bag when it's 1/2 to 1/3 full. And that's just to prevent it from getting too full and kind of like hanging down and pulling on the site. When washing the site, you want to make sure that they're not using any oils, fragrance, soaps, anything like that. They just want to use warm water and a cloth and just clean the stoma and then around it. And after they're done cleaning it, you want to make sure that they dry it off before they put the appliance on.